Erectile dysfunction is when a man is not able to sustain or achieve an erection that is acceptable or satisfactory for sexual relations. So part of that is a bit defined by the patient. And once we get to know them and what their goals are, we can decide what are their best treatment options. There's many different treatment options for erectile dysfunction. We first start off with optimizing lifestyle. So the safest thing that we should all recommend our patients that have erectile dysfunction is to engage in lifestyle modification. It means exercising more, eating healthier, and trying to lose weight when that's appropriate. We also want to value what's going on mentally. We know that erections are not just a matter of physical health. It's also about mental health and mental well-being. So we ask those questions, and we're very comfortable helping people out and putting them in the right direction and steering them in the right direction. We can offer pills, injections, gels. We can also offer rehab techniques through vacuum erection devices as well as traction devices. But what if those options don't work? There are great options, and that's with a penile prosthesis. A penile implants have been around for many years. There's different types. There's bendable rods called malleables, and those are very reliable, but they're not as natural as the three-piece inflatable devices. They're all self-contained. They all stay within the patient. In a few years, that's why they're called three pieces.
Penile prosthesis is also known as an implant. There are three components to the penile prosthesis. Two cylinders, which sit in the body of the penis, a pump, which sits in the scrotum, and a balloon that is placed in another location. The surgery itself can take anywhere between 1 to 2 hours before a man would decide to have an implant. Oftentimes, his significant other is involved in the process. We sit, we talk, we explain, we answer all questions. If the man decides to proceed with the surgery, after consultation, once the decision is made to proceed with surgery, the success of this procedure is predicated on the reproducibility of the procedure each and every time. We use the same steps, we use the same team, and we perform more in most places in the country. The expectations for the patient postoperatively involve some discomfort with an overnight stay. Afterwards, partnership between the prosthetic urologist at University of Southern California and the patient, the postoperative course involves antibiotics, pain control, and communication with the patient. After 6 weeks of postoperative recovery, the penile prosthesis is ready to be used. It makes us happy when we see men whose lives were devastated by the lack of intimacy turn it around and be able to enjoy intimacy with their partner. The quality of life that is gained by the surgery, although seemingly complicated, is well worth it. So it is quite simple functioning for this prosthetic apparatus. There is a balloon reservoir, cylinders, and a pump. The balloon reservoir houses fluid. The default position, obviously, is to be deflated. When intimacy is desired, the pump is squeezed to transfer the fluid from the balloon reservoir to the cylinders in order to produce rigidity for sexual relations. The patient who decides on a penile prosthesis is at the point where all other options have been exhausted. With placement of the penile prosthesis, it's still pleasurable and you are still able to achieve orgasm. The feeling is still intact and the intimacy is restored with this device. After you've exhausted all possibilities of non-surgical intervention, as long as your diabetes is under control, your blood pressure has been managed, and you are an operative candidate, a discussion of risks and benefits can be undertaken, and the patient can be qualified for a surgery. At Keck Medicine of USC, are pioneers in prosthetic urology. In addition to being a high-volume center, we work with the companies for trials and modifications to make the device even better and more user-friendly for patients. Research in the department is devoted to men's health and prosthetics. There are many grants in the department, as well as a training ground for the future leaders. Erectile dysfunction can be embarrassing. Many men tend to shy away from speaking with their healthcare provider about their issue. As a team, we can regain the intimacy you so desperately seek and re-spark the romance in your life.